I'll call to order this Tolland Town Council meeting of February 13th, 2024. Due to the weather, this is a virtual meeting only. We'll start with the Pledge of Allegiance and a moment of silence. So if we could please stand. I pledge allegiance to the flag of the United States of America and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right. Next on our agenda is proclamations and presentations, of which we don't have any. And then public petitions, communications, and public participation. This is on with any subject within the jurisdiction of town council with a 2-minute limit. If you wish to speak at this time, you can raise your Zoom hand, and we would ask for you to state your name and address for the record. And so I'll start in order. The first is Rebecca Risley. So let's see if we can.
Thanks. Can you hear me? I think I'm
yes.
unmuted. Okay, great. Thank you. Rebecca Risley, 103 Mountain Spring Road. Thank you for allowing me the opportunity to speak. When the conversation doesn't change, the possibility for change and improvement is lost. For the sake of our town, please listen to the residents that are suggesting we provide our schools a minimum of a level services budget year over year. Change the conversation from an arbitrary number that you will believe to pass at referendum on the first try. It's a disservice to our community, and it's a limited view of what's important to the residents. We're a varied town economically. Some make more, some less, some even at the poverty line, just like any town in this country. However, it's consistently ignored that the average median income for many, many years has remained in excess of $110,000 per household. Use programs to assist seniors. Freeze tax rates on a case-by-case basis. If someone can prove a need, like the crumbling foundations, I know that's been done in that case. If the programs aren't robust enough, let's find a way as a community to provide more help. But using the fund balance every year, although not desirable, I know it's not even what I'm suggesting, certainly not using it every year, but using it this year to maintain a level services budget makes sense to stop the bleed. We're taking cuts we will not recover from with 0% budgets. The school system and town need to work together on a 5-year plan after that to keep us from stagnating and falling back into that same hole we've been clawing out of for 10 years. We refuse to keep up consistently with inflation and modernization requirements, and we're left perpetually fighting the same battle. So please shift the conversation from we have tough choices to make about where we can cut to how do we work together as a community to keep our schools vibrant for successive generations of Tolland families. Several ways this can happen. Utilize the tax stabilization fund. It was created using excess money from the state when we budgeted conservatively low and were awarded more than expected. Use it for its intended purpose this year to lessen or negate an additional tax burden on residents. Utilize a one-time expenditure from the unassigned fund balance to make up the difference and provide a level services budget. Allow the strength and value of our schools to diminish, and we're not doing due diligence to homeowners and returning on their investment. Thank you.
Thank you, Rebecca. The next is Kate H.B.
Thank you. My name is Kate Howard Bender. I live at 103 Goose Lane. Hello, Town Council and Mr. Foley and everybody else who works for Tolland. And thank you. I would like to invite you to take advantage of an exciting opportunity. Because our town is in such a wonderful fiscal position, as articulated by our auditor, our director of finance, and many of you counselors, you have the ability to work with the Board of Education to ensure a level services budget for the first time in at least 10 years. This is not about making sure we don't lose French or that we don't lose computer science at the middle school. This is about securing our community investment. Happily, Tolland has a significant amount of unexpected income that you can choose to allot to the Board of Education expenses. As you may have heard, LOL, the Board of Education is attempting to negotiate a huge fiscal hole in order to get level services. The reasons the BOE is in this position are multitudinous and are not suited to a 2-minute share, though they are well documented for all to see. What a blessing it would be to the entire community for you, our leaders, to work across party lines and ensure that the needs of our students are met, thus changing the trajectory of the town from hopeless to hopeful, eschewing the hand-wringing in favor of solution seeking. Thank you for the time and dedication to our town. I believe in you and I believe in Tolland.
Thank you. Is there anyone else who would like to speak at this point? You can raise your Zoom hand or press *9. Anyone else? All right. Not seeing anyone. We will move on in our agenda to public hearing items, of which we have none. And then reports of boards and committees responsible to the council. Let's start here with the ARPA subcommittee. Did you guys meet since our last?
No, we, excuse me, no, we have not met since last time.
And just as a procedurally, I know in our special meeting last week, the council did vote on a large item. Is ARPA going to continue to meet? Like procedurally, what's the plan for ARPA now that we've committed most or all of those funds?
Yeah, sure. So we'll probably just end up canceling a few, especially probably I would assume the next few months. And I think Brian noted last week towards the end, I'm thinking September, October, we might need to get, I think he said aggressively when we start realizing that some of the funds, Scott, I'm sure he's going to do a great job. So if he gets to save more, then we're obviously going to need to spend that money. Am I correct with that, Brian and Lisa? If that's what, and
Absolutely,
Jake,
absolutely, and Chair, I believe, I'm certain money's coming back into ARPA, so we're going to have more decisions to make, and we'll meet. Right now, it's stagnant, but I know of some cost savings are already coming in on previous stuff we've approved, so all is not lost.
Yep. So we'll be busy towards, whenever, but right now we've got a break.
Excellent.
Yep.
And what about the firehouse subcommittee?
So we meet on Thursday. It's a rather large agenda, many change orders. Looks like the contractor wants to push it out by 77 days, which drops it to end date of May 31st. And just going to be a long, lengthy, good conversation for that meeting. I don't know, Jacob or Brian, you have anything to add to that? No? Okay.
No, ma'am.
All right. So that's all I have.
And for the road salt task force, we did hold a public meeting on January 25th. We will meet again later this month, although we're still negotiating a date for that. And we do have an item on tonight's agenda to discuss. Any questions, comments about any of those three committees that report directly to council? Okay. We'll now move on to reports of town council liaisons. Chris, you're first on my screen. Do you want to go first?
Yeah, sure. I attended the Planning and Zoning Commission meeting last night. They had a conversation with our state senator and Representative Ackert. Just wanted to bring them in and have sort of a dialogue with the state level. In particular, they spent a fair amount of time talking about affordable housing and ways in which Tolland, the challenges that Tolland might face to reach some state standards. They also reviewed preliminarily the senior pickleball, the pickleball courts that are going at the senior center. I think those are coming from some ARPA funds, but separate and apart from they're earmarked for the senior center. And then they also set public hearings for a couple of special permits. One for a barn and the other for allowing breweries and farm cideries to sell alcoholic beverages that were manufactured within 30 miles of the premises and not specifically on it. So I think that's about all I have.
Thank you. Jen, do you have any?
I don't have much. PCC Permanent Celebration Committee, they met during a town council meeting. I was informed that they really didn't have much of a meeting. It was just to accommodate the Girl Scouts who did a presentation on a townwide bingo program that they'd want to do. Their next meeting was supposed to be for the 15th of February, but I just got notice that they're going to be canceling. So it looks like next meeting is going to be March 21st.
Thank you. Colleen.
Yeah, so the Recreation Advisory Board met last night. The youth coaches were there last night to give an update on the field usage and their schedules. Bruce also talked about the enrollments for his programs and also a new can't refund policy. And we also, or the group went over the field assessments as well. But I have no other committees to report on.
Thank you. Joe?
So yeah, I attended the agriculture committee meeting on the 5th, and there's actually a good group of people that are on that committee. It was nice. It was a nice meeting. Very enthusiastic group, and they are looking to develop or I guess it's out there, but there's really nothing on it. The Tolland Green Market website. So it's different than the farmers market website. So the farmers market is the market that basically moved over to the near the country butcher. But the Tolland Green Market is just still working on the Tolland Green. So they're trying to develop a website that they can upload some pictures of, and they can have they can list the calendar of events that are going to happen for that, and then also allow the vendors who attend the Tolland Green Market to put links to their particular websites to advertise for themselves, and then add sort of an about farmers market write up on the website as well. And then one of the things too that they mentioned, they're looking for some additional $1,000 in the funding. They've reached out to Brian for that, but I didn't get the details of what the additional funding is for. So maybe Brian can speak of that. And they're also trying to look for some business sponsors to help pay for some of the costs associated with this. They don't charge the vendors that show up for these markets a fee to be on the green. So they're looking for some sponsors to cover those costs. And then they're also looking to possibly have a regional agricultural meeting. So different towns that want to get together, their agriculture departments get together and so just sort of talk about best practices. And then lastly, they were looking, there's a Campbell farm, which I don't know a lot about, just learning about these things, but apparently they need a well on this farm, and they're talking about getting a well for the person that's using this property, and I believe it's town-owned property. And then lastly, they're looking to have a student from Tolland High who might be interested in becoming a liaison for the committee. And that was it.
That was a great update, Joe.
Yeah, thanks. It was interesting. It was a good meeting.
Good.
Yeah.
Good.
Jacob.
So the Economic Development Commission met a couple weeks ago. They also had a pretty interesting discussion, so I'll give some of the highlights. They spent the first part of the meeting talking about developing a community currency, which that was kind of an interesting idea. So it's still kind of up in the early stages, but the idea would be kind of like some gift certificates that would be applicable to any local business in town that wanted to participate. There's, I guess, a few municipalities that already do this and have had some success in using this to kind of encourage and help local businesses. So it was a cool idea. They also discussed ways to promote and help new local businesses, such as creating some welcome letters for newly registered businesses up in town that kind of lay out what town resources are available for those new business owners, and also working to try to make the webpage with those resources a bit more user friendly and accessible. And then lastly, one thing that they had talked about, again, just kind of stir some commerce and some support for local businesses, was to try to plan some more town green events. Again, no like firm plans, but they spent a good amount of time talking about potential ideas that I guess the EDC might want to sponsor or promote one way or another's. One idea that they seem particularly interested in would be doing a movie night or something up in the summer, which I thought was a cool idea. So overall, pretty interesting meeting.
Thank you.
Yep.
I attended a few meetings as well. Let's see, I attended a CROG policy board meeting where they approved their legislative plan. They also applied for some funding for CROG on a couple of things. They're a pretty active group. And they're gonna hope to further their legislative agenda for this session, which is very consistent with what they've been working on in various ways to support the communities within the CROG. The Eastern Highland Health District is supposed to meet later this week, but that meeting got canceled, so that's going to be kicked out until April, I think. That's the next scheduled meeting. And the other meeting, the Historic District Commission meeting in January was canceled. They are scheduled to meet in February on the 21st. And Jacob and I had a meeting last night with leadership from Board of Ed. We had what I thought was a great conversation with Board of Ed leadership regarding their budget. And they, as some of our community members have spoken about, are trying to develop a budget and wanted to know, what the appetite of the council was to support a Board of Ed budget. And Jacob and I, of course, can't commit to anything. We are 2 members of council, not the 7 complete member council, but we did say we were interested in having a conversation with the Board of Ed once they present their budget to understand how, what funding avenues are available to us. I think both Jacob and I expressed some interest in a multi-year spending plan from the Board of Ed, and I certainly committed to work with the Board of Ed on that in any way that I could. So I hope we hear from the Board of Ed about what their budget is. I think that goes to Brian later this week. And from there, we do have an upcoming joint meeting between the council and the Board of Ed. This is a charter required meeting. It is going to be Thursday, February 22nd, if I'm remembering correctly. We are going to hold that meeting. I believe it's been confirmed in the Tolland High School library. That room seems to have the best technology options for a large board like our joint board to meet. So we will be holding that meeting in the library of the high school. It starts at 7 p.m. And the purpose of this meeting is for the council and the Board of Ed to have a formal conversation regarding the Board of Ed budget. There will be a presentation of their budget. There'll be an opportunity for council members to ask questions about the Board of Ed budget. There will be an opportunity for Board of Ed members to ask questions of us, although our budget doesn't come out until March 13th, a month from today. So we won't know a lot about our budget, but we did have a great conversation with Tony and Jen about making sure that we're all committed to having a productive meeting at that time. And so I'm really looking forward to that as well. And I did want to pass along the request from the Board of Ed members that town council members ahead of that meeting read, at the very least, read the FAQ document that Dr. Willett has posted on his website. I will make sure that that gets emailed out to everyone. I might wait, if you don't mind, until Thursday or Friday after Brian has the budget, because I believe we can also get a link to the actual budget and the FAQ. And the request is that town council members do read that FAQ ahead of the joint meeting, because a lot of very important and essential questions have already been asked and answered. And in order for us to have the most productive meeting, we don't want to have a lot of repetition. So there's your homework, guys. I understand it. It's a 70 some odd questions as of yesterday. That's what they said. It's a robust document.
Can I just make a comment, Katie?
Yes, please.
Yeah, no, I just wanted to say thank you to you and Tony, Jen Galachant, and Jacob, of course, for doing this meeting, I think monthly, or is it monthly you meet him?
Yeah.
It's something I think that should have been done a while ago. I remember we tried to do that years ago and it just didn't work out. So I think it's really important. And like Katie did say, a lot of those questions have been answered, and in previous experience, we can spend a lot of time asking questions and that have already been done. So thank you for you and Jacob for doing that legwork and not making any decisions without the rest of the group. Thank you.
Of course. Jacob, anything you want to add?
No, it was a good meeting. I think it still set the stage for some really productive conversations later on.
Yeah, absolutely. All right. Any other questions about any reports from boards or commissions?
Sequence of return points, 1% of
Okay.
return games,
So
one.
we will move on now to, there goes my dog,
Converted. All goes into melts.
to new business. And that starts with a presentation on human services.
On hard courts last year, Alex Dimon.
Hi, Katie. You want me to jump in? Okay.
Sorry,
Great.
sorry, Katie. I was on mute. So Bev, before you go, so as a council and to our public, when a new council comes in, we'd like to introduce new town departments, or the town departments to the new town councilors, and they give a basic overview as to the services they provide to the town. And it's good to have, as the budget process is right down the road here. So with that, tonight, we have a couple of things on the agenda: human services, and after that, Eastern Highland Health District are just all going to introduce themselves tonight. So Bev Bellady is the director of our human services. She needs no introduction. She's someone that we all here in Town Hall rely on very, very heavily for too many things. So and she's going to introduce the rest of her staff. I see Kim and Jillian, and also Teresa Christoph, the new assistant director of human services, who many of you might not have met yet. I was hoping this meeting to be in person, but Mother Nature had a different idea on hand. So, but with that, thank you, Bev, for letting me jump in front of you here, and go ahead and say what you got to say.
Okay, great. Thank you. I'm also pleased to report that this fall I'll have the honor of working for the town for 35 years. So although I have witnessed, yeah, I know. Although I have witnessed a great deal of changes in the town, the Human Services Department has continued to stay true of its mission to serve the Tolland residents of all ages, to achieve and maintain personal and social well-being. The Senior Center is also a function of the Human Services Department, and our Senior Center Director, Kim Kwaskin, is also on the Zoom tonight if you have any questions. Our department consists of 5 professional full-time employees and 2 part-time. We're fortunate to have extremely knowledgeable and dedicated staff, and I'm pleased to be fully staffed finally. We also serve as staff liaison to the Commission on People with Disabilities, Tolland Local Prevention Council, Youth Review Board and Youth Advisory Board, and the Water Commission. We seek to administer human service, youth, and senior center related grants. I think one of our best skills in the department is being able to administer many entitlement programs for residents when they come in, whether it's fuel assistance or medical or any benefit program. One of the primary services we provide at this time of year is fuel assistance. We're an intake site for the state fuel assistance program, and we have seen a significant increase in residents requesting assistance. And also, unfortunately, them going through their benefits rather quickly, as the state has not been as generous as in previous years. With that, we have sought other fuel assistance programs, Tri-Town Fuel Bank, some donations from local community members to assist them and if they're in a crisis. We've also seen a significant request for food assistance in our food pantry. I think and Jillian, who helps out with that too. We're serving probably 5 to 6 families a week that come into our office for that. Other programs we do is the rent a rebate, obviously the food pantry. We administer the housing rehabilitation program. We do case management and crisis intervention services, as well as elderly outreach. And our elderly outreach worker is a Medicare Choice is certified in the Medicare Choices program, so she can help residents with those very complicated issues with Medicare. At this point, I see Teresa's on too. We can talk about some of the youth service programs if you'd like.
Thank you, Bev. Hi, everyone. My name is Teresa Kristoff. I am the new Assistant Director of Human Services. Just to give you a little bit of background on me, since it's the first time I'm meeting most of you. I am a Tolland resident. I reside here with my husband. We have a toddler, our son, and we have a yellow lab. I am coming to you from Yale New Haven Children's Hospital, where I've spent the past almost 9 years as a certified child life specialist. So in that role, I'm working directly with families as an educator and an advocate. And so using a lot of the skills that I'm now using here in human services, providing education, crisis counseling, emotional support, and connecting families to resources. I spent a lot of time building relationships with nonprofits and local businesses as well. So it's a perfect fit as far as skill-wise goes. I joined the town on January 2nd. And so I've learned a lot from Bev, as you can imagine, about the entitlement programs that Human Services provides, the support that we can provide to residents. So I'm happy to answer any questions about that. But like Bev mentioned, I would love to talk about the Youth Services Bureau, because that is a unique part of the Assistant Director role. So I coordinate the Tolland YSB, our Youth Services Bureau, and that's our town's branch of the statewide network of youth services. So we all belong to the Connecticut Youth Services Association, or the CYSA. And so I participate in those meetings with other town youth services programs. I've learned a lot from those nearby. We've done a lot of meetings with Vernon and Manchester just to learn a little bit about, what they're offering to the youth. We had our legislative meeting recently, which was on January 22nd, and that was a really great opportunity for youth service programs across the state to really talk directly to our legislators and our state representatives about not only the grant funding that we receive, but also what positive youth development we're providing to youth. I was really excited to represent Tolland because we have a reputation, which was exciting. Our youth services community theater program was cited as one of the most unique positive youth development programs because of the wide range of ages that we serve. So kids kindergarten through age 18 being involved in one program together is pretty rare. And so the leadership and mentorship opportunities that provides was really well renowned. So it was nice to represent Tolland. It was my first meeting, and we were already getting such positive accolades from other youth services. So that was wonderful. Another piece of, coordinating the YSB is running the Juvenile Review Board. And so for those of you who might be new to the town, just to review, the JRB is comprised of volunteers from local and state agencies. We have members of the school. Typically we have an SRO, but we are working to try to get resident trooper involvement But the goal is to provide trauma-informed, culturally sensitive, restorative justice. And what that really means is holding youth accountable for their behaviors in a supportive environment. And so in fiscal year 23, there were 5 cases served by the JRB, but I can tell you that those numbers have already climbed since I got here. So I've serviced a few intakes myself, and we have a few hearings in progress. So it's a really positive mentorship opportunity for youth when they need to, repair harm that's been done, but get them back on the right track, keep them in school and keep them out of the justice system. And something I'm excited to talk to the town council about specifically when reviewing your goals is the local prevention council. And the subgroup of that being the youth advisory board. And so I coordinate our LPC, our local prevention council, and we just met on January 24th. There's group representatives from the town, faith-based organizations, the nonprofits, local health departments, and the school system. So it's a really great group that I've enjoyed working with thus far. And the goal is really to make recommendations to the youth services program and to provide awareness and prevention programs, so substance abuse awareness, to the community. All of our funding is grant-based for the LPC. And typically there's a subgroup called the Youth Advisory Board. And when I arrived, the Youth Advisory Board wasn't active. And so one of my first things that I wanted to do was get that active again. So I did put out some advertisements with the Board of Ed, and I'm thrilled to say we had students reach out to me and they want to join. So I'm really excited about that, to get that group up and running again. My goal would be to really work with them on a youth-driven social marketing campaign and then discuss mentorship and leadership skill development for that group and kind of the youth-to-youth, peer-to-peer perspective. So I'm really excited about that. But the big focus of the LPC moving forward, knowing that recently the Mental Health and Substance Use Advisory Task Force dissolved, our focus is really using those recommendations and putting action into play. One of the big priorities being hiring a prevention specialist. So we've been meeting with area local social service agencies, seeing, what is Vernon doing? What is Manchester doing? They have a prevention coordinator who's trying to become certified as a prevention specialist. And we've met with the director of Hockenham Valley Community Council. So just seeing, what resources are out there and how can we make those recommendations from the task force come to life. I'm thrilled to say that our case manager, Jillian Fiddler, she's such an asset to our department. She's really embedded in the community and with the youth. And so she's currently undergoing the certification and credentialing as a prevention specialist. And so this is going to be a huge skill set to add to our department. And it's also going to help to ensure the longevity of having that available. And so I've been studying up on what the task force has presented, and really thank you to them for doing all the groundwork of identifying, what the big issues are in the town, what's prevalent for the youth. So now I'm taking all this information and hoping to move forward with it and make our action plan. So to address this issue, it needs to be multifaceted. And so Jill, doing the prevention specialist piece from our community standpoint, she can provide education, triage, assessment, referrals, and do that outreach in the schools and that engagement with people in the community level. And then we also need to look at what the task force presented in terms of mental health needs. And so there was a lot of presentation about the anxiety, the depression that our youth is facing. And so knowing that these youth are probably not going to walk into the town hall, human services knocking on our door when they have those problems. So how can we meet that need? And so having someone in our department that can do the outreach and support, but then partnering with someone at HVCC to do the clinical component. So it seems like having both branches might be the best way to tackle this problem. So that's just a start. And that's, what's been a big focus of me the last month or so since I've gotten here. I've learned a lot. We've done a lot of assessing of, what are the gaps in human services? What additional offerings can we provide? We've updated forms and translated things into Spanish and made things fillable PDFs online. We've been really trying to update and optimize. So I'm happy to answer any questions, but I don't want to monopolize time, but that is kind of what I've been working on the last month. And I'm hoping that it aligns well with the town council goals, and I'm excited to work with all of you. So thank you.
Thank you. Is Kim going to talk too, or should we go right to questions?
I can talk. I didn't find out about the meeting till yesterday. So if anybody has any questions for me, the senior center is a place where seniors can come it's a community for them. We try to do programs that keep them active and young, and they get to be together. It's just a great sense of community there, and it's a great place to work. And if anybody has any questions, I'll be happy to answer them.
Thank you. Well, thank you for all that information. Does anyone from the council have any questions?
Can I just say something, Katie?
Yes, please go ahead, Kelly.
So you all know how much I appreciate everything you do in your offices, three of you ladies. And so I love to hear, Teresa, about how you're using the information from the mental health task force, because Jacob and I both served on that. And it sounds like you're very excited to use that material. And I just want to say thank
Yeah.
you for using that, because I know another counselor, I don't think he's here tonight, Alex, he was concerned that we've done all this work and spent money on something that wasn't being utilized. So I just wanted to just say thank you for that.
No, that's great. And really, it's helped me. I mean, I'm a resident of the town, but I'm coming in a different viewpoint now. So now I can see kind of directly from the residents, right? You guys did that incredible survey. So the information's there. So it's really to my advantage to use it. So thank you guys.
Yeah, really echo what Colleen says, and it sounds like you have a really good team working there, and I love how you described how you're working to handle these problems and really reach out to different groups, especially youth.
If I can just say, Katie, real quick, I just want to thank all of you. The Human Services Department in our town is fantastic, and you do really important work. And Teresa, welcome on board. And I think you bring an awesome background. And if there's anything that we can do as a council to help the department at all, let us know.
Thank you.
Thank you so much.
Sorry, Jen or Joe, do you have anything? No? Okay. I just had a few things. I wanted to make sure that you guys took a minute to tell us a little bit about the Tolland Care and Share program that happens over both Thanksgiving and Christmas time, I believe.
You mean the Care and Share program that we do
Yeah.
every year? Yeah.
Yeah.
Thank you, Katie. That's a program between the community outreach as well, and we work with the state police too with their Stop a Cruiser program to help families that could use some extra help during the holidays. And we also raise funds to distribute to the three senior housing to give them gift cards for the holidays. It's a program I've been doing since I got here, but you know, with the staff this year, it was wonderful too, because they just jumped right in and helped out. And we also saw an increase in need for that as well. So,
And that's mostly the contributions from that are coming from mostly other community members.
other community residents, the Lions Club, that's where all the funding's from, everything that we get.
Thank you. I hope that anyone listening remembers this again come Thanksgiving and Christmas time towards the end of the year, because it's a really wonderful program that a
Appreciate
lot of
that.
people are able to participate in. And
Yeah.
I think it does some great good. It's a wonderful opportunity, I think, for our community to make a difference within our own community. And so I would extend my gratitude to your office, Bev, because it takes a lot of coordination, and I know it's an anonymous program, so you have a lot of work kind of coordinating all this, but thank you very much for that.
I do have to say that Tolland is probably one of the most generous communities. Anytime there's a need, they reach right out to us, whether it's, I forgot to mention sometimes the back to school vouchers and the programs to help kids in the school, whether it's to help with, some classes or tutoring. We can always find somebody that will help us with that.
That's great. That's great to
Thanks.
hear. Thank you. And the other question I had, and I'll be honest, this question got fed to me by the kids in my house. But they're very interested to know if the youth theater is going to happen again this summer.
Oh, yes, definitely. We've already had our first meeting. Jillian, who's in my office, is gonna take the lead on that with us, and she also, I don't know if she can speak, but she also was in the play when she was younger, and then as she aged out, she became a staff member. So I'm looking forward to have that continuity and working, and Teresa's looking forward to participating in it too. So
Yes,
Awesome.
we plan to have the save the date in the community newsletter, but we can't tell you what the production is yet. We're close to deciding, but we
Yeah.
can't
Alright.
reveal it just yet.
All right. Well, my household is looking forward to finding out what the play is going to be this summer, because this is always a really wonderful.
Yeah, it's a fun program.
It is, and the kids get a lot out of it. My kids have been enjoying it since I think were in kindergarten. So thank you very much, as always, for all the work that you do. And if there's anything that the council can do to help support some of your endeavors, please pass that, to us directly or through Brian. I'm aware of the limitations of funding for the home heating
Yeah.
assistance program. I know that our legislative delegation is also aware. And I think everyone wishes we could do more there. So we'll continue to advocate for areas of increased state funding. If you think that we can help with that, please let us know.
I will. I definitely will. I know there's some movement underground on that too, but I'll definitely, through Brian, let you know and pass it on.
Cool. Yep. Okay. Any other questions for Human Services? Oh, okay. Well, thank
Thank
you
you.
very much for
Yeah.
coming tonight. It was great to meet you, Jillian, and we look forward to doing more work with you. Thank you. All right. Next is Eastern Highland Health District.
All right, great. So, for anyone wondering if I appear distracted, I am, because I have Rob Miller in my office here with me, and we're able to talk about the human services stuff. There he is. So he's going to jump in here in front of my computer. He has a screen that he's going to share. So it's been entertaining, to say the least. But here's Rob Miller. For our new people on council and to our public, we do not have a public health department here within town. Most towns don't. Some of your bigger cities do, and obviously then there's a state Department of Public Health, but we don't. Instead, basically, we join a consortium of towns and we hire Eastern Highland Health District to be our public health service here, and the director of that is Mr. Rob Miller, and they do a great job. They've really stepped up in this Salt in the Wells task force. And we couldn't be happier. We were really stuck without them, so we're happy to have them jumping on board. So here's Rob Miller.
Thank you, Brian. Thank you, Madam Chair and counselors, for inviting me here tonight. And thank you, Brian, for letting me sit in your spot. I do have some slides I want to share here with the group. So let's see. I'm going to share screen. Let's see. Where's show slides? So there we go. Everybody see that okay? Okay, great. So as Brian said, my name is Rob Miller. I've been the Eastern Highlands Health District Director for about 27 years, since its inception in 1997. And but that's not where I started my career. I actually started my career in public health with the town of Tolland. Bev and I worked together for about 6 years, 35 years ago, when I was a town sanitarian, worked in this very building. And so Tolland became my home during that period, and I got to know the community rather well, and was very pleased when the health district formed in '97. Very soon after that, the town of Tolland decided to join us, and so I think it's been an excellent fit ever since. And I've always had the pleasure of working with Bev and the town team here and the town hall over the years. And so with that intro on me, I just want to talk a little bit about the health district very quickly here. It is a district of 10 municipalities here in Eastern Connecticut. As I indicated, it formed in '97. And 3 years later, Tolland and Wellington joined, and then another 4 or 5 years after that, the other 5 communities joined. And I'm not going to list them all off because I might make a mistake. I do know them, but I can still make a mistake. We've been at a total population of about 80,000 people over that period until today. The health district is governed by a board of directors, and Madam Chair and Town Manager Foley are members, your representatives on our board of directors. I answer to the board. The board's 14-member voting block, and they meet about six times a year. And they are the policy making board. They can set rules, they can set ordinances, they adopt a budget, and they adopt per capita rate a contribution for all the member towns. We've got 12 staff. As you know, you've all met Chris, who works out of our Tolland side office, who does a great job. Chris is on vacation this week, but that's the advantage of having a health district. We have staff, which is going to be backing him up during his vacation. This year's budget operating budget was a little over $1 million. It is a 2.5% increase in the per capita contribution rate to our member towns, and a total spending increase for the total budget of about 1.8%. The board adopted that budget subsequent to a public hearing just this past January. The relationship between the Eastern Highlands Health District and the town of Tolland is actually provided for in state statute. There's no contract, no agreements, no memorandum of understanding. The terms of our relationship are wholly detailed within Connecticut state statute. So from that perspective, the health district is in effect an instrumentality of the state of Connecticut. But as Brian said, we are your local public health department, and I've always encouraged the town manager to treat me as a department head, and our staff as town staff, and that's always worked very well for us over the years. So tonight I'm going to talk just briefly about these are 4 main program areas that the health district engages in and provides to all of our member towns. Community health, communicable disease control, environmental health, and I think that's the program the health district probably best well known for because of restaurant septics and that kind of thing, complaint investigation, and public health emergency preparedness. Talking about community health, since the pandemic, our involvement in behavioral health has grown. Like I think much of the public health discipline. While we were engaged in addressing some of the opioid misuse issues in our communities, it's really ramped up even more post-pandemic here. We have a partnership with North Central District Department of Health, which is the health district that Vernon uses. And we together got a grant which allowed us to engage with additional partners to implement some local strategies to prevent overdose and opioid misuse. In particular, what that means is that we actually engaged and coordinated a number of harm reduction events. We actually did 2 here in Tolland. We partnered with Connecticut Harm Reduction Alliance. They set up some tables and did Narcan kit distribution and training and other counseling. Actually here in Tolland, we had distributed 55 kits, and those kiosks engaged up to about 700 residents doing those 200 events. Because we try to target those events where there's going to be a lot of foot traffic. So I believe they're at the Tolland Harvard Festival, and I think there was a Celebrate Tolland event too they attended. QPR training is, I'm sure Bev and her team know what this is. Question, persuade, and refer. Again, kind of targeting the youth in our community. We have a couple of staff. Our public health nurses are trained trainers, and have engaged some of the school systems. We did a training among our school nurses. I know Tolland was represented during that event a few months ago. And we continue to look for opportunities to provide that service. Active living projects, that's funded by a preventive health services and preventive health block grant. We've had this grant money for many years. We've been using it to support and promote active living and healthy eating over the years. It's funded a number of active living projects. We've done a few over the years. In Tolland, the most recent, you may recall from Bruce Watt, was that we were able to use the grant to provide and purchase a number of kayaks for low or no cost loaner program here in Tolland. Health education programming. Again, our public health nurses do a lot of this. We tend to provide programming on topical or seasonal issues, either during summer, during tick-borne diseases, or during the winter. It's radon prevention. And also, sometimes there are emerging issues that arise, whether it's Triple E or whether it's Triple E or Eastern equine encephalitis or West Nile virus or whatever. We are always looking for opportunities to get information out to the public. We use all the typical media streams you might imagine, and plus we'll go out into the community and do talks and engage people in person. Radon testing program, again, it's a partnership with the State Health Department. We give out free radon testing kits. It's kind of a limited number every year. Depends on how many the state can afford to provide us, but this program is not only a service that's free for residents, but it duals as a data collection program. State's trying to collect residential data on the prevalence and severity of radon in residential settings around the state, so they use this program for that purposes. We do have some kits left, so if anybody's listening wants to pick up a kit, they can come to the Mansfield main office at the Rubeck Municipal Building, or they can give us a call and we can make sure we can save one for them. And our number at the main office is 860-429-3325. Let's see. Communicable disease control, outbreaks, investigations, case interviews, controls. This is we do a large part of this is behind the scenes work. The general public isn't necessarily aware that we're engaged in these kinds of activities. We conduct about 30 investigations a year in infectious disease outbreaks, whether it's a GI outbreak in a long-term care facility, or foodborne outbreak with a restaurant, or COVID outbreak in a daycare. We investigate about 30 outbreaks a year. You never hear about them in the media because it's technically confidential information, but we're out there doing it. In the state of Connecticut, infectious diseases are mandatory reportable to local health department and the state of Connecticut. So not counting COVID, we got about 650 cases reported to us over the year. We kind of review each record to see if any appropriate follow-ups are necessary. Out of those, we did about 79 interviews, and then from there, as I said, we did about 30 investigations. And that's not even counting COVID. In COVID, we had 260 cases over this past year, and 450 of them were in Tolland. And we called most of those up just to provide education. We still have a little COVID grant money, so we have the staff and resources to still do that. So we are to kind of help people along if they have questions about COVID, then we provide that information. And a part of that ongoing COVID funding is COVID test kit distribution, a distribution initiative we have currently, we're currently engaged in. We've distributed about 3,000 kits district-wide, about 450 of them here in Tolland, between all the public schools and the daycares. And we still have kits available for free if anybody wants them. Again, they can give us a call and we'll make sure they get the kits. Part and parcel to our communicable disease control program is our vaccination program. We do flu clinics. We did a number of them this past year. We did 3 in Tolland. We administered about 50 doses during those 3 clinics. We're also part of a bridge program. What that means is that it's a bridge between the free COVID-19 vaccine that was available. Now that it's no longer free and it's been commercialized, local public health departments can still provide free COVID vaccine to individuals who are uninsured or underinsured. And then lastly, under the vaccination program, we continue to get free vaccine for kids under the age of 18. And so we continue to do free flu clinics and COVID-19 clinics for kids in our health district through this current respiratory season, and we'll continue to do so into the summer. And again, health education, it's part and parcel to many of these programs. With regards to this, it's all about respiratory etiquette and covering your cough. We have lots of information out there. We're currently engaged in an initiative to try to get more people to try to address barriers to vaccine uptake. So we're going to be launching some initiatives in that regard. And so more to come on that. And then finally on this slide, disease surveillance and reporting. We collect data on all kinds of diseases within the health district. Our data sources are state, hospitals, some local data. We put out a weekly report on viral respiratory illnesses to all the community partners and stakeholders. We put out annual reports with our annual report. And during periods of intense concern, we'll put out specific information. You may recall during the EEE issue, just before the pandemic hit a number of years ago, we were putting out regular information on that. So we'll always address topical issues too when it comes to emerging diseases and our community partners' need for information. So the environmental health program, these are a number of, environmental health is largely driven by, as I said, it's kind of the bread and butter of what we do. It's much of the regulatory oversight we provide in our communities is environmental health and nature. There have been a number of new code updates over the year that have really commanded a lot of resources from us. In terms of adjusting, making change, and both internally and externally. The health district has always been obligated to do annual inspections of cosmetology establishments, salons, barbershops, but we never had the standards to do it and do it well. So we just adopted some new sanitary code a little over a year and a half ago, and that program's been going pretty well. We rolled that out in a very, I believe, thoughtful, meaningful way. We engaged all the local businesses, got them involved in the development of the code, got their feedback on the proposed code, and in the year and a half we've been operating it, doing those annual inspections and issuing annual operating permits has been going pretty well, I think. And so, So I would have to say, from my perspective, it has been reasonably well received by the business community. The FDA food code, that's a major change here in the state of Connecticut. It used to be the Connecticut Public Health Food Safety Code, but then the state shifted gears and adopted the federal FDA code by reference. And what that means is that it's a whole new inspection form, a whole new set of codes. It took quite a bit of training among our field staff to bring everybody up to snuff on that. And certainly there's an educational component and a learning curve for our local business restaurant operators. And we worked with them to bring them up to speed on all of that. I have to say, though, while it did take quite a bit of effort, this is a good code. It's science-based. It's easier to understand. It's easy to justify when it comes to enforcement. And enforcement provides more latitude by local public health and local inspectors when it comes to enforcement. It really facilitates kind of a partnership in coming to compliance rather than kind of just telling them how to do it and what to do. So from that perspective, I think this is generally a better code. Childhood lead protection regulations, another major change, also commanding quite a bit of resources from the health district. The elevated blood lead standards for young children was reduced materially. And now the state of Connecticut now aligns with the CDC standards for blood lead levels in children. And that wasn't the case until just recently. But with that comes more case management. Well, our nurses are managing probably 4 to 6-fold more cases now as a result of that. We're also conducting 4 to 6-fold more site visits and issuing more orders to abate. So it's a relatively heavy lift, but obviously it's important to protect the youth and the very young in our communities from environmental lead exposure, because frankly, the bottom line is that no level of lead in child blood is good. The multi-jurisdiction MOU, licensing reciprocity, a bill came down the pipe from the legislature a few years ago, in which it helped establish this interjurisdictional MOU, which we're signed on to. It's really a option for local public health jurisdiction to sign on to, but once you're signed on, then you honor terms of that agreement, which effectively allows for licensing reciprocity for mobile itinerant food vendors from one jurisdiction to the other for those who have signed on to this agreement. So, so we're happy to do that. It allows small mom and pop and individual businesses to avoid extra paperwork and extra fees. And so I think it's a good way to support our local businesses. Some of the basic programs that, again, we're well known for is inspections. In Tolland over this past year, we've done 32 cosmetology inspections, 111 food safety inspections, 160 septic inspections, 22 well permits have been issued, 83 septic permits have issued, 30 complaints have been investigated. There are all kinds of complaints. Here in rural communities, you can imagine the types of complaints that we get. Certainly we get housing complaints, but we also get wildlife complaints, we get mosquito complaints, drinking water complaints. And so we could probably write a book, quite frankly, on the variety and the diversity of the types of complaints. I've always felt like, anyway, if a complaint comes to the town hall, they'll go to the town manager, say, well, try the building department. They'll go eventually. If a kid doesn't fit any particular neat box within a municipal department, then it ends up in the health department, and that's okay. We don't mind. We'll see what they have to say and what their issue is, and we'll help them figure it out. Public health emergency preparedness. Well, certainly this came in handy during the public health emergency response to the pandemic. But a part of what our ongoing efforts is, we're constantly updating our emergency response plans, our mass dispensing plans. Training among staff and volunteers is ongoing. We do quarterly call down drills. All my senior staff are trained in the incident command system, and so are many of our key volunteers. We have a strong cadre of Medical Reserve Corps volunteers. We've got a roster of about 200 volunteers who are instrumental in helping us respond to the pandemic and staff our testing sites and our mass vaccination clinics. About 10 or 15% of those 200 are actually Tolland residents. We keep them engaged with regular trainings, such as QPR and Stop the Bleed and other topical issues that are helpful to them. And then finally and lastly, we're active in Demis Region 3 and ESF 8, which is the emergency supports function for health and medical. Our health district's part of the public health subcommittee under ESF 8, and we attend are active in those meetings on behalf of Tolland and the other municipalities that are in Region 3. So lastly, this is the last slide. These are kind of initiatives that we're currently engaged in or plan to be engaged in the very near future. The Health District is overdue for updating its strategic plan, which is important when it comes to making sure our goals, our board goals and operating goals are updated. We're looking to create billing for our vaccine program so that it's a sustainable enterprise fund in effect. And we're really hopeful to develop that extra source of revenue. And it hasn't been easy, quite frankly. Insurance companies aren't necessarily welcoming local health departments into their healthcare networks. But I'm about 8 months into this, and so far we've been successful in getting Medicare. We can bill Medicare now, and we've signed a contract with Connecticut, but Cigna and Anthem and Aetna are challenging, but we're going to continue to grind away at it and do the best we can. Hopefully we can get a steady source of revenue and keep this program going. Opioid misuse, we're got a new grant coming down the pipe, again, partnering with the North Central District Department of Health. We're looking to expand those interventions I talked about before. And so in the upcoming year, plus so more to come on that. Got a workforce development grant. Like any industry, the workforce and labor market has been really challenging. And public health is no exception to that. That's the one thing that kind of keeps me up at night. What happens when one of our senior sanitarian goes? It's been real challenging to keep those positions filled. And so we're going to be applying this grant to keep people trained and invested in the organization and in the industry and in the profession. Immunization grant, I referred to that briefly before. Again, that's going to be working hard to do an assessment, community assessment on the barriers to vaccine uptake, and then crafting a campaign to address those. And so you'll see more of that towards the end of this season and certainly for next season. Preventive health strategies is, again, it's a block grant. We received monies to do a hypertension prevention program. We're going to be doing outreach and education, a number of classes. We're going to be passing out high quality free blood pressure monitors to participants and looking to help people keep their blood pressure down. And then finally, as Brian alluded to, we're also supporting many of our communities when it comes to sodium chloride contamination. Tolland isn't the only town in our jurisdiction with this problem, although Tolland's problem is, I think, uniquely challenging in many respects, but our other towns also have some problems too, and so we're engaged in that district-wide. And so with that, I've just thrown a lot of information, talked pretty fast, and I'd be glad to answer any questions you may have.
Thank you, Rob. Do any of the council members have questions for Rob? Jacob, go ahead.
Yeah, so I know you haven't you've finished a strategic plan yet, but it did kind of pique my interest. Are there anything in particular, Rob, that you're excited to put into a strategic plan over the next few years?
Well, so we have a plan, it's just old. And I would say many of the goals identified in that original plan are probably going to remain. I think it's there may be maybe one or two may be added or deleted. I think what it really comes down to is the objectives under those plans. And right off the top of my head, I mean, this last slide that I just showed you is addressing, I think, two really important issues for the health district. One is workforce development. We really need to figure out a way to not only recruit staff in an effective way, but retain them for the long term. It's been a challenge for many local public health departments in the state of Connecticut. And then identifying alternative sources of revenue, right, to take the pressure off the local taxpayer and local businesses. And the vaccine billing initiative is one of those alternative sources. Again, looking for grant funds is another alternative. So the objective of trying to find alternative sources of revenue to offset pressures on local tax and businesses is certainly an important, I think, piece of that. And to that point, the health district actually has among these grants I've identified here in this slide, plus a few others, we have about $700,000 worth of grants coming in over the next 4 years or so. So we'll put that money to good work over that period of time. I think also, in addition to that, we're always looking to improve productivity in various ways. So I'm really talking not necessarily about the broader goals necessarily, but more the objectives. While the goals certainly provide important guidance and are going to drive the direction of the health district, I like to focus on the objectives to get things done.
Thank you. And just to touch a little bit on the workforce and talent development portion of that, how many people does EHHD employ right now?
We have 12.
Okay.
Yeah, we've got 5 environmental health professionals. They're called sanitarians here in the state of Connecticut. One of them is a chief sanitarian. We've got 2 public health nurses. We've got 2 health educators. One's kind of a senior public health practitioner. And then we've got emergency preparedness coordinator and an office manager. I think that's 12.
Okay. Thank you.
Yeah, no problem.
Yeah, I'm all good, Katie.
Thanks, Jacob. Do any of the other council members have any questions? Go ahead, Chris.
Just a couple quick questions on the last point you mentioned, the sodium chloride mitigation support. I'm just curious, like how prevalent those issues are in the other towns that you service, how often that's coming up, and anything you've seen that's worked and that kind of thing. I know you've worked on this with the town as well, but I was just curious about other communities.
So I would say the other community in our district which is challenged by this issue is town of Coventry. They have a cluster of homes similar to the Vineyards area, whose wells are contaminated. And they've been working just like with Tolland, an environmental health consultant, and the DEP on coming up with methods and tactics to solve the problem. Unlike Tolland, however, Coventry's cluster is in proximity to community water supply. And so that, I suspect, ultimately, while they're looking at all the options, I think ultimately is going to be the solution. It's going to be expensive. It's going to be millions of dollars. But it appears that in the long run, it's going to be probably the best option for the community. They're still working on it. They're still looking at some of the other options. But that appears to be the direction they're going at this point in time. The other towns which have, first of all the towns have, I think, are touched by this. The health district actually did a survey. We've been collecting some information on this, and we've identified about 150 wells, or really more specifically water tests, because some of these water tests, we don't know whether it's water that's been treated or whether it's raw water. So we can't say whether it's groundwater or not, or whether it's an issue that a treatment system's not being operating properly. Either way, it poses a risk to groundwater quality, because if they're discharging, if they're not using the water treatment system properly, then that's a risk. But so about over the past 6 years, we've identified about 150 water tests which have been problematic. And so we've been working with the DEP. We've made them aware of that information, and we'll continue to support our towns. One of the things we will be doing, and Madam Chair and some of the other more councilors are aware of this. I said it during the public forum a few weeks ago, is that we're going to be working on a campaign to get information out to the community, and quite frankly, to tell you the truth, it's going to be district wide. The things that we're thinking of for Tolland, where the health district's going to be implementing for all our communities. For the most part, there may be some exception, but it makes sense given the prevalence of this problem, at least within our jurisdiction.
Great, thank you.
Yep.
Do any other council members have questions? No. Rob, I have a question about regulation when it comes to water softeners.
Mhm.
And is this something that the health district is starting to explore?
So the regulation that's in place now isn't specific to water softeners. It's to water treatment, wastewater discharges. There is provisions within the Connecticut Public Health Code subsurface sewage disposal regulations, which provide standards for the design and installation of the septic leaching fields, which are just for the discharge of water treatment systems like water softeners. And so our role under those regulations is to review those plans against those standards, and if they meet the standards, then approve the plans. There's not necessarily an inspection or a permit issued. It's simply approval of a plan, and then the installer is obligated to provide us an as-built of where they actually put it in, and then we put it into the town records. The regulations beyond that, the health district anyway hasn't specifically looked into that. I think as I've said before in the past, I think there's some administrative things that we can do that I'm looking very closely at now in terms of getting information to those individuals, or requiring extra information from those individuals who are applying for or submitting those plans for review. Presumably they're doing it because they're installing a treatment system. So maybe we should know a little bit more about the treatment system, about the water quality, what they're actually treating for, and whether or not the water quality matches up what they're actually proposing for treatment. And so administratively, I think we can do some of that. I think quite frankly, if we're looking at something more than that, an actual ordinance or regulation, as I have said before in the past, the health district would be glad to work with the town of Tolland if they want to look at something specific for their community. We could certainly support an evaluation of such a thing.
Thank you. And I would also extend my gratitude for EHHD for being such a good partner to the town on the issue of contaminated wells. It's been a pleasure to work with you on this. So thank you for all your support.
You're welcome.
Any other questions for Rob or Eastern Highland Health? No? Okay. Well, thank you very much, Rob.
You're welcome. And thank you, Madam Chair and councilors.
Thank you.
Brian, you can have your seat back.
The next item on our agenda, also has to do with contaminated wells. It's a consideration of a resolution making an additional appropriation of $86,800 from the general fund unassigned fund balance to the capital testing insurance account, which has a lot of numbers involved in it. to be used for costs related to the next steps in well contamination investigations by Langen Engineering and Environmental Services Incorporated, and authorizes the town manager to enter into an agreement with Langen. Brian, you want to tee this up?
Sure. I have Michael Wilkinson here to assist, and Lisa Hancock, our financial director, as well. Well, Michael's largely been handling the legal aspect of it out of the town manager's office here, and the insurance aspect as well. So it's growing in cost, and this issue's been hanging over the town of Tolland's head for years and years and years, since I think everyone on this long before everyone on this council started in their roles here. So when I was asked to take the job, one of the things I was asked to bring some solutions to, and stop kicking the can down the road, and was this problem here. And there's a cost that's, every time we do something, there's obviously a cost. So this is another step in paying that down. And so Mike, do you have anything you want to add to that?
Just that the funds that we had been using, we are our insurance company, Kerma, we're a member. So periodically we get equity amounts back to them, which we put into an account. That's the funds that we had been using for Langen. But those funds have been exhausted. So this just appropriates money from fund balance. Again, the Road Salt Task Force led by Katie discussed this prior to bringing it to the council. And this is the continuation of what Deep has kind of directed the town to do. The main thrust of some of the services in this 86,000 is to look at these 4 different locations. Deep tries to call them one-offs because they're not in a cluster area, and try to investigate what's going on at those areas. So that's one of the aspects of this next authorization that is before you.
Thank you. I would like to open the floor up to questions. I just want to add that our legal advisor on this, Ann Catino from Heller and Sage, did work with the vendor, with Langen, to develop this particular proposal. And the hope is that this authorization would bring Langen services to the town through the end of the fiscal year, so through June 30th of this year. And I'd like to open the floor up to questions before I ask mine. Does anybody have any questions about this?
Yeah, I've got a question, Katie.
Please.
Yeah. Right, there you go. So first of all, I mean, obviously I'm in favor of doing what we need to get this situation resolved. You know, we have to make the necessary investments. But my question is, you know, how does this, I guess I'm going to assume that this is probably not going to be the last request for additional funding for Langen. So I'm just kind of wondering, how does this fit up into the overall tentative plan for a solution? Like what additional things will be needed after this? Has Langen kind of laid out any sort of tentative roadmap as to what data they're hoping to collect and they believe that they will need to collect in order to offer some sort of proposal to us?
I guess I'll jump on that, Katie, unless you want to fill in. I get that. So the Road Salt Task Force really is addressing a lot of this and monitoring the progress as it goes along. We do have a shorter term roadmap that we need more. We need Langdon to do more things to really start coming up with solutions, solution based. One address of the ones in town, when we're getting closer and closer to a solution. Then that's not one of the vineyard addresses, it's one of the one-offs. Then we really want to start looking at solutions for all the other addresses as well. We have a plan. It's in the process of being executed. but it's going to be costly and we expect more money down the road. But your guess is as good as mine, Jacob, as to how much more we're going to need. We got to see what happens with the solutions, and there's just a lot that needs to be ironed out.
Mhm.
And I would add to that, that it has been a part of my learning as part of this Roads Health Task Force that every property or cluster of properties, perhaps, needs a unique solution. There is no one size fits all solution for each property. And we've seen that play out in at least one property already in town where, we thought we had a proposed solution. We went ahead and did the work to make sure that our solution was going to work. Then it didn't. And then we had to go on to another step in the solution process, because there are so many factors involved in contamination. There are an equal number of factors involved in resolution. So this is complicated, and every house that has contamination will require a customized solution. That being said, one of the things that Langen is working on is sort of a standardized process of going through each property and conducting whatever needs to be done, evaluation for each property. And that is something we are working on, but every property is going to have its own solution.
Okay. I think that's good that they're kind of putting together, I don't know, playbook for maybe lack of a better term, for each property. I just think about it, because as we continue to get deeper up into this project, I just definitely concerned about, where we're going, with all these different studies and things like that. It's certainly part of the solution, but I guess there's part of me that's just nervous, that we can also lose sight of the main objective there. So thank you.
Yeah, I that's a great point. And I think this proposal does lay out the steps to work towards resolution on some of these one-off properties, and to continue the collaborative work between Langen and the Roads Health Task Force. But this study is very much focused on solutions for these one-off properties.
Mm-hmm. All right, thank you.
And I will say that in the last Roads Health Task Force meeting, my very frank question was, how much is this going to cost the town? Like this whole thing, right? How much is it going to cost the town to find resolution for our residents on contaminated wells? And there is no answer. Ann Catino works on cases like this and other environmental impact cases for municipalities all over the state. And she gave us a lot of information on how other municipalities approach this. And we're doing what we need to do to find resolution for our residents, but this process is not going to be easy. And we are going to need financial support, and the quantity, that the dollar figure is unknown at this point.
Yeah. That's well, and that this is coming out of the unassigned fund balance, correct? So and that's what it's for, for these sorts of things. But important thing to keep in mind.
Yep. Thank you.
All right. That's all I have. Thank you, Katie and Brian.
Thank you. Chris, did you have a question?
Yeah, just one comment and then one question. So I just want to thank the Roads Health Task Force and all the effort that everyone's putting in. It's a problem that sort of built up over years, and unfortunately, it's not, an immediate resolution. But I think it's good that the Roads Health Task Force is pushing towards resolutions, because for people living in these houses, it has to be obviously unbearable. The one question I do have, though, is this 86,800 that we're voting on tonight. Obviously, I'm in support of it. But it deals with the 4 one-off properties. Does it where does the vineyard stand? Is there no, do we need to, is there money that's going to be needed for that, or where does that stand?
I think that compiling the data from the vineyards is part of this, but a lot of the work in the vineyards is going to be done by Eastern Highland Health.
Okay.
And so that's, this is a wonderful benefit of our relationship with Eastern Highland Health. And we're very grateful for their assistance and support here.
Great, thanks.
Jen, you had a question?
I guess just a clarification, maybe I'm just not interpreting correctly. So I'm looking at all the tasks that are included in this amount that's going to be approved. And task 1 is assumingly for things that were already done, correct? Okay. So is the rest of this stuff that hasn't been done yet, or is some of it stuff that's already been done as well?
No, nothing else besides task 1 has been completed.
Okay. So it's like task 1, we gotta pay for that because it's already been done, but the rest of the stuff is still in the future.
Yes.
Okay, that's all I needed for clarification. Thank you.
Yep. Any other questions about this? No, okay. Lisa, I guess, I feel like we've had a lot of recent conversations to understand our financial overview as a town, but can you just put on the record, do we have sufficient funds in the unassigned fund balance to cover this $86,800?
Yes, we do.
Thank you. Thank you. All right. Well, if there are no more questions, is there a motion to approve the resolution as assigned in 8.3?
So moved.
Thank you, Chris. Is there a second?
Second.
Thank you, Jacob. And we're going to do a roll call because we're on Zoom. And I'm just going to go in order of how I see you guys. Chris?
Yes.
Jen?
Aye.
Colleen?
Aye.
Joe?
Aye.
Jacob?
Aye.
And I am also an aye, so that is unanimously passed. Thank you very much. The next item on our agenda is a financial overview by Lisa. So please take it away.
All right, so thank you, Chair. And so our financial director, Lisa Hitchcock, as a result of this council's request, and I'm sure and a lot of have wanted this, is a quarterly update provided to council, provided by Lisa Hancock. Last council meeting, it was problematic based on where we were in the budget process. So I thank you all for giving us a little grace on that and letting us leapfrog to this next meeting. So without further ado, where are we, Lisa?
Good evening, everybody. Just a quick overview. What I have, can you see my screen? Okay. What I have here is a high-level summary of just a snapshot of where we were as of the end of December. And it shows the comparative to the same time in December last year as well. Most importantly, if you look at the revenue section, I'm caveating it all that these are all just estimates at this time. Things can change within the next quarter, but this is my best guesstimate through June 30th of where I think we'll be. And I think revenues will exceed the budgeted amount by a little over almost $1.1 million. Now, a majority of that is from intergovernmental revenues that were unexpected, and also for example, ECS money. We have a little over 175,000 that was approved after our budget was adopted. So we had no control. We went with the governor's figures, and the legislature did reinstate $175,000 in ECS money. The other part of the intergovernmental revenue has to do with a sales tax revenue that gets approved, but it doesn't get approved until after the budget is also completed. And from my understanding, the governor's proposal in the upcoming budget is going to eliminate these funds. In the past 2 years, we've been fortunate to get this money, but we never know what the amount is going to be. So unfortunately, there was no way we could budget it. That amount is a little over 370,000, 368,000, just for those 2 grants. Then there's some other minor amounts in that 372,000. The other big piece of this excess revenue that I'm looking at, again, is with investment income. And as of the end of December, we had collected almost 554,000 versus our $200,000 budget that we had for investment income. When putting the budget together, we had been advised by all our advisors that the Federal Reserve was going to be reducing investment interest. So even though we pumped up the budget number this year, they haven't started reducing the in interest rates as of yet. They're looking at it. They're cautiously approaching how they're going to be reducing it. But we've been fortunate to be able to continue to get pretty high investment returns around 5%. So with that in mind, and if these rates continue, I'm estimating that we will have $913,000 in investment interest, which is a little over $700,000 extra. So that in your revenue side of things, these I mean, it's great news. You're going to exceed the budget if all holds true. Again, we'll have a better feel at the end of March. And then, of course, when we get towards June, it'll even be better. Now, with the excess revenues from the intergovernmental revenue, those funds fall under our municipal tax stabilization ordinance. Whereas, excuse me, 75% of that excess revenue will go into the municipal tax stabilization fund, and the other 25% will go into the capital non-recurring fund. That will happen automatically at the end of the fiscal year once we get through all our other revenue sources, because the ordinance says to, before we're moving money out, we have to make sure our other revenues are in sync and doing well also. Otherwise, they may be needed to offset the budget. The ordinance provides the policy and guideline for how all that is managed. Again, if it holds true, we won't have to use the $200,000 that we estimated using for fund balance this year, and the revenues will flow back into those various funds. Now, when we get to the expenditure side of things, it looks a little funky here. The budget will not be overdrawn by 598,000 as it's reflecting here in this spreadsheet. It's just the way we have to show things for now. What these funds here show the amount that will be transferred out to the various funds, as well as a estimate for the Board of Education 1% fund. The Board of Education will come back after the third quarter and will be requesting the money that they had left over at the end of last fiscal year, which I think was around 172.5. So that is factored in here as being estimated to be transferred out, along with the CNRE and the tax stabilization money. So that's reflected in here. Now, the other areas, excuse me, we have much of our savings that are estimated at this time have to do with attrition. We've lost a lot of employees. We had some savings in our public safety area for our state trooper retiring. Again, these are all estimated, and it's all going to depend on how the rest of the year goes. for those items. The Board of Education, at this point, we just expect them to spend every penny. Whether they do or don't, we won't know, but that's what we usually do each year. So if all of this holds true with my estimates, we could see an increase in fund balance of about $475,000 at the end of the fiscal year, depending on how well we do with the revenues in actuality and the expenditures. We've pretty much made most of our transfers regarding the wages for settled contracts, things like that. So a lot of those things are in place for now. So that's where we stand as we speak, and I'd like to just open it up to any questions if you have any. And this was just my summary of pretty much what I just spoke about.
Does anyone have any questions for Lisa? Colleen, go ahead.
It's more of a comment. Again, Lisa, thank you for your amazing work. And I'm so glad that we're starting to do this. Like we are, it just seems like the town is just getting better and better financially. Would that be a safe assumption from all the investments and everything the town has been doing?
Yes, I mean, we've been very fortunate in that area. The next year budget, we'll see what happens. We're planning on increasing that. Just waiting to see what happens as far as, the investment and things like that.
Okay. So how much more money is being put into the unassigned balance? Did you say it was 400,000 or?
It's all going to depend. Right now, it's the number at the bottom right of my screen, 475,592 is my estimate at this time.
Yeah.
Again, I'm already hearing, some departments may need some of these savings to deal with repairs that might come up that were unexpected, that, they budget so tightly that sometimes the attrition helps with funding all those other needs without having to come back to town council to ask for more money. But at this point, we haven't made any transfers for anybody from the attrition savings.
Okay, I think that's just all I really had, Katie. Thank you. Thank you,
Thanks,
Lisa.
Colleen.
Welcome.
Jacob?
Yeah. So again, thank you, Lisa, for putting this together. It's always helpful. Just going back to that intergovernmental line that you were talking about on the revenue side. So you mentioned something about state sales tax revenue, I think. Could you just maybe describe that a little bit more?
Sure. There's a fund at the state level where they collect sales tax rate, and they keep track of, how much sales tax is earned within each community. And then there are expenditures that are based on using some of those funds. Whatever is left over after the state budget needs are met for what they plan to use those funds for gets split up between the different communities. And they don't know what that number is until after June 30th. And that's when they determine the amount that will be allocated. So this year and last year, we were fortunate to get some pretty significant amounts that moved into the stabilization fund. I can't tell you exactly details of what the state uses part of that fund for, but it comes from the the sales tax revenues that the state collects.
Okay. And year to year, how much we get varies, and it's not necessarily predictable.
And it's only been 2 years now, last year and this year.
Okay. Thank you.
Mhm.
Does anyone else have any questions for Lisa?
I just want to thank you, Lisa, for putting this together and for doing such an excellent job managing our finances and our investments. So I think you've done a an excellent job setting Tolland up financially for success. So thank you.
Thank you. And just to give credit to my assistant, Chris Jordan, he's the one who makes all the money on the investments. He keeps real busy with moving money around and investing every penny he can.
Pass our thanks along to him as well. Thanks.
I need him in my life. Make me rich.
Any other questions for Lisa? I have a few. Thank you, Lisa. I think getting these on a quarterly basis is incredibly helpful to me and to the whole council. So thank you for the time it takes to put this together. I'm getting better at reading it every time I see it. So there's hope, right? Thank you so much. The estimated 475,000 at the bottom, that would potentially be deposited into unassigned fund balance. Does that include the $200,000 that was budgeted to be withdrawn from fund balance for the quarter, or is that not included in that figure?
It's the net effect of the excess revenues and the expenditures. So the plan is that we won't have to use that $200,000. So it's all factored in there.
Okay, so the plan is we won't use that $200,000, and we would, again, estimated potentially deposit $475,000 as well, in addition to not withdrawing the 200,000.
That is correct.
Thank you.
75% though, Lisa, right?
No, no, this part here is after all revenues less expenditures. The 75% and 25% thing is reflected mostly in these numbers here. Do you see where I'm rolling my mouse?
Yep.
The only other thing included in this 308,000 is the 172.5 for the Board of Ed, but everything else for the stabilization fund and CNRE are in here, so that's out of that. So those funds there that you see there are going to add to those other funds.
Right.
Had you not had that in place, your fund balance would have gone up even higher.
Right. So we're going to deposit an estimated $475,000 at the end of the fiscal year, estimated into unassigned fund balance, plus it's hard to, I'm sorry, I can't see on your screen, in a $300,000 into Board of Ed and CNRE, plus $407,000 into municipal tax stabilization.
Correct.
Okay. Thank you. Those are great numbers. It's really fun when this isn't depressing. So thank you, Lisa, for working your magic so it's not depressing. And also the investment income is wonderful. I do also join Colleen, and I'm sure the rest of my colleagues here, you know, the fact that we've been able to really bring in additional income this year without expending a single taxpayer dollar is a wonderful it's a wonderful service to our town. So thank you. Thanks to your staff for making that happen. We appreciate it. We appreciate it a lot. I know that right now, or end of the calendar year, as of 12/31, we had an investment income of about $550,000. Is there any chance we might end the fiscal year less than $550,000?
Oh, no. I mean, this number right here is what we've collected so far. So it's only going to get better.
Okay. But like, you know, if I were to do investments, I have to like spend a little money to make money. So are we spending money to make money here?
No. Municipal governments are very strict on what we can invest in by state statute. And you have to keep your net asset value to $1. So for each dollar, there's no way we can invest general fund operating money in risky investments that could lose $1. You may not earn as much interest. However, but with the type of investments that we are in, they're collateralized, and there's a lot of safeties in place.
Thank you. I really appreciate that. Giving us that information. Well, again, I don't have any more questions. Does anybody else have any other questions for Lisa? No, okay. Again, thank you, Lisa, for doing this. This is now one of my highlights of the quarter, so thank you very much. It's incredibly helpful.
You're very welcome.
All right, we'll move on to our next item on the agenda, which is appointments to vacancies on municipal boards and commissions. We do have a appointment recommendation for a vacancy on the Planning and Zoning Commission. We did have a resignation on Planning and Zoning Commission, and we have a letter that came in from the chairperson of the Tolland Democratic Town Committee, where they nominated Amanda Hickey to fill this vacancy. Is there any questions, talking points on this?
I'll say
Just like-
something. Go ahead, Chris.
Go ahead, Colleen.
Well, Amanda Hickey, you definitely will be a great permanent person on that commission. She has been already serving as the alternate, as we probably all know, and she's extremely smart and dedicated. And I think Amanda will be an excellent asset to the Planning and Zoning Commission. And just speaking to a few of them, they told me that they really, really like her. So that will be a really good fit for everybody. So that's all I had to say.
Thank you, Colleen. Chris, go ahead.
Yeah, I'm just going to echo mostly what Colleen said. As the liaison to planning and zoning, I think I've seen Amanda at every meeting. She's been seated as an alternate, and even when she hasn't, she was still attending. So I think she'll be a great addition full-time to the commission.
Thank you. Any other comments or questions? Is there then a motion to approve the appointment of 8.5A for Amanda Hickey for the Planning and Zoning Commission?
I'll make that motion.
Thank you, Colleen. Is there a second?
Second.
Thanks, Chris. So we're going to just go through a roll call vote because we are virtual. Chris?
Aye.
Jen?
Aye.
Colleen?
Aye.
Joe?
Aye.
Jacob?
Aye.
I am also an aye, so that is unanimous. Thank you. And Chris and Joe, you guys are working on some more appointments, recommended appointments.
Yeah, that's right. Actually, yes, that's correct. I'm trying to pull up my email here really quickly. Joe, do you want to add on the Board of Assessment Appeals, Diane Clokey?
Loki, yeah. Yeah, go ahead. I think we were trying to, were we going to try to get her on the agenda tonight for approval? Or
Yeah,
we
I was just, yeah, is it possible to add her now, Katie, or can I make a motion for that, or do we want to wait?
If you want to make a motion, or we can wait and do it in 2 weeks. I don't think they're going to meet between now and 2 weeks from now. So I don't think there's any urgency.
Okay.
Yeah, we can add her then in 2
Okay.
weeks, I guess. So we're not rushing through it.
Wonderful. Wonderful. And I'm glad to hear we're getting some candidates for Board of Assessment Appeals. Thank you, Jacob, for the efforts that you made to try to drum up some interest in that. And I hope we can get that board filled for the upcoming assessment reval process. So thank you for all those efforts to all of you.
Totally.
Great. Okay. So then we will move on to old business, of which there is none. And item 10 on our agenda is the report from the town manager. So this is all you, Brian.
All right, good evening, everybody. Thank you. So I'll start out with the storm. Obviously, it's over now. Yesterday afternoon, I met with our DPW director and our emergency management director and discussed things like staffing, timing, Public Safety, who our liaison with Eversource, our contacts at Emergency Management. As you know, yesterday, mid-afternoon, we were getting some pretty high totals, and we actually ended up, I'd say, meeting those. This due to the timing of the storm, and at that point yesterday afternoon around 4:30, largely being during business hours today, and obviously all up until about 1 p.m. It was snowing pretty bad here in town. We made the decision to close town hall. I hate to do that. I hate the optics of it, but we had to decide so that people could bring stuff home, so that we could set up again to have this meeting here virtual. We just had a lot of things to really to call yesterday. We also had to figure out the trash situation with Costello, and so I think we managed well. I'm pretty sure it was the right call to close town hall. It was a disaster this morning. The roads right up until about 1 o'clock or so, the roads started to get halfway decent, at least here in Tolland, but not all of our commuters come from Tolland. Some come from quite far away. So power outages were minimal. Accidents were minimal. Like listening to the scanner, other towns had a lot more than Tolland did. I met with DPW Director Lappin at about 11 or so to kind of see where we're at and what the plan was moving forward. And he's confident we'll have obviously the schools and everything set for tomorrow morning. The roads are actually in really good shape if you drive around. Moving on. So I was asked to discuss our engineering situation. So for those new to council, when we're going to do a project, we're going to build something, repair something, we need an engineering services to do so. And when I got here, there was a lot of consternation expressed, and basically it was decided that it was time for a change, and there'll be a positive fiscal component for the town in changing an engineer. So we put out an RFP. We considered many different factors. I had a team that looked at the RFPs and met with the engineering firms. And so we've basically selected 2 new firms moving forward, Russo being really the main one that'll do like buildings and such after that. And I think it's a positive thing. Moving on from that, you'll see that attached in this package and out of the assessor's office is the signed 2023 grand list. Has some modest growth to it, but certainly not a negative by any stretch of the imagination. Our building department continues to do well. Jim Paquin, our buildings person, he's doing a lot of different things at this point, a lot of big projects between the Girl Scouts, the Santini project, and the dispensary. For someone involved in Jim's role here in town, those are 3 big things to be tackling. Several months ago, I also asked him to just really to start watching over the firehouse project, not in any official capacity, but just going over there and looking around, because he serves as an advisor to all of us, and he's kind of got a good eye to see if things are being done right, wrong, or otherwise. Chair, you had asked last week what we had 2 new special events permits. One was for a disc golf tournament at Cross Farms, which is you're starting to see more and more of those now. There's golf tournaments at golf places. This is a disc golf tournament at Cross Farms. It's great for the town. And then the other one was the Little League opening day at Cross Farms, which was the other one. I don't have the date right here in front of me, but I'll get it out to you. It's great for town council to pop in to those things, and it's just fantastic to see all the families and the kids getting excited for the new year. So happy with Human Services and how they presented themselves today. I look at it, if I talk about the senior center and the children's play, the numbers alone from those 2 events that of citizens get served here, it's incredible. You'll see periodically I'll pop in the senior center when I have a vacancy in my calendar, and I did so last week, and it certainly did not disappoint. It was full. The parking lot was full. It was 9 o'clock. The chair yoga, the volunteers getting ready for lunch, volunteers coming in for the food pantry. They had both pool tables full, and then a bridge tournament going on all down in the basement as well. and the staff there was very busy. So very happy to see that out of Human Services and for them to get to present themselves so strongly today. I was gonna tell you that they had their first meeting for the play, the children's theater. I was hoping they'd tell us what the name of the play was, but they did not, unfortunately. I figured, Katie, you could have ordered them to tell us or something, but no such luck. So we're also, we talked about the pickleball situation over at the senior center. Again, to refresh anyone's memory, there's ARPA money that came in outside of our ARPA process, and it came from the federal government to the town, specifically earmarked for senior centers and certain projects. That ARPA money is not enough to pay for the pickleball court. However, our human services people get donations often directly to the senior centers, and they believe they can make most of it happen with the extra donations, which will be the brunt of the cost, by the way, will be through donations. Also assisting in getting that price to be doable, DPW is going to have to do a lot of the tasks involved too as well to help save money. So it's turning out to be quite a team effort on everyone's account. As far as grant applications, there's nothing new. We get so many, Megan gets so many different types of things across her desk that she has to look into to see where they can fit into the town. I review every one of them as well, and we try to be as creative as we can without getting the town into any kind of trouble or biting off more than we can chew. The Firehouse Subcommittee meets this week, as Colleen had stated, but if you drive by over there, you're going to see that we have ourselves a building. The roof's on, most of the walls are on, and it's starting to look like a firehouse. As far as animal control, some new laws came out with animal control facilities, of which we have one here in town. Not every town does. And the laws that they're mostly codes that the fence needs to be a certain height, the dogs need to be a certain certainly a certain distance apart, that right down to like the chain link fence, the squares can only be so big, and so we're going to need a new dog or animal control facility in the next. Luckily the state laws came out with I want to say 5 or 6 year lead time before we have to implement them. We really are close to meeting. We're really close to not being up to specs as it is. And these new laws are going to make us really far behind. Better than other towns, but still, one of our neighbors was recently shut down as a result of some of these things. We all went over and inspected this past week. That is the animal control officer, Chief Lytell, Jim, our buildings guy, Scott Lappin, and had a look at the facility. It's really not that bad, but I understand the changes, and that's the world we live in, and we're going to have to do it. My instructions to John were, we will look for a grant in the meantime of those 5 years, but let's put it into the capital plan down the road or shortly thereafter. So that's where we stand with that. While we're on him, as emergency management director, we've been directed by the state of Connecticut to come up with a plan for should we get any migrants here in our town unexpectedly, and how we're going to handle it. He has put together a plan. I reviewed and approved it, and once it's done or signed off on, we'll get it to all of you. We're obviously vetting it through Demas, and while we're there, I met with our regional coordinator, Josh Signorelli. He's a former weather person at Channel 30, but he's like an assistant fire chief as well in another town. So he's really into a lot of this stuff. So it was a great connection to make. Our paths did not cross when I was with the state. But we talked, he came here and we talked about a lot of the things we're talking about now, this migrant plan specifically, some of the legalities, what we're required to do and not do. And so we put together a plan, and I think it'll meet with everyone's approval, and I'll get it to you when we have it. I told you how John was, how we did today with the with the storms, minimal public safety impact. I know John had the staff come in a little early. Moving on to Public Works, the rink was a success. And if you look at the weather, we might be able to squeeze in a day or two this weekend. If that's the case, I will have a key and I'll come down and open it myself. As you've probably seen, I go in on the weekends, I go down with my drill and check the ice and see where we stand on it. And if I can do it, we will do it. And I look forward to it. It's going to be close on Sunday morning is my best guess. Basically, for the public out there, what we need for the rink in the most general of terms are 4 days in a row where it doesn't go over 32 degrees. And, if there's already pre-existing ice, that may change things, a little bit. So there's some give and take there, but that's the general rule. And if you look at the temperatures coming up, it's certainly not that, but it's going to be close. And I'll be there with my tape measure and my drill this weekend to see if I can't pop that fence open and get it open. And that is all I have. I'm obviously open to any questions.
Thanks, Brian. Jen, do you have a question?
Yeah, do we have someone temporarily filling in to replace Trooper Eklund? And then can you just go through the names of who we have for resident troopers right now?
Yeah, give me 1 second. I thought I had it up and now I dropped it. Let me look in 2 places here. One more spot. It's in my emails, Jen, and I got so many from Lytel here. He's the one that got it to us. Just give me if you want to move on, Katie, can I jump back in when I get it?
Yeah, absolutely. Thank you. We have filled the 4th position though, right? We have 4 troopers in town right now.
I'm sorry. Yes, we do have 4 troopers in town and got it. Okay. Sorry.
Okay.
Yes, Jared Boldick, Lionel Hyatt, Nuccio, and Godwin is the one that's on the TTY temporarily assigned to the town. Those are all junior troopers as well. Junior less than 4 years.
Okay. Any other questions, Jen?
No, thank you for doing that on the fly.
I should have had it. Tammy or Katie told me.
You gave him a heads up you were going to ask that question. While we're on the topic of troopers, have we gotten any additional data than what was in the manager's report, which is the standard data from Troop C?
No,
Have they started providing us any data? Okay.
no. I did have a good meeting a few weeks ago with the sergeant, one of the sergeants out of Troop C. Many things discussed, very positive. So moving forward.
Okay, thank you. I also wanted to thank you for getting those special event permits. That was my question for you today on this report, so thank you. Does anyone else have any questions for Brian on the town manager's report? No, we're cruising. All right. So the next item on our agenda is adoption of minutes. And we have in our packet the minutes from the January 23rd, 2024 regular meeting and the January 25th, 2024 special meeting. Is there a motion to approve those minutes?
I'll make that motion.
Thank you, Colleen. Is there a second?
I'll second it.
Thank you, Jacob. Is there any discussion on these minutes? No. All right, we will do roll call then. Chris?
Aye.
Jen?
Aye.
Colleen? Aye.
Joe?
Aye.
Jacob?
Aye.
I am also an aye, so that is unanimous. Thank you very much. All right, Colleen, the next item on the agenda is correspondence to council.
All right. We have received a lot of them and I need to start emailing everybody back soon. But anyway, so we got one regarding a 5-year strategic plan. One concern of use of fund balance, one suggesting ways to minimize tax impact, 18 emails supporting the Board of Ed budget request, and an email regarding keeping band in schools. I think that's all I have to date.
Thank you. It is that time of year when we get lots of emails, so thank you for reporting into us on this. Any questions, comments about correspondence? Yes, Jen.
Sorry, cut out for me. How many emails was it in support of the Board of Ed?
So 18, then there was one email specifically talking about band in schools, so I don't want to really speak for that resident as the entire amount, but because that was very, very specific, but yep. 18 emails supporting Board of Ed budget requests. One suggestion ways to minimize tax impact, which was using the different unassigned balance or tax stabilization. Then one concern of using those funds, and then another one regarding a 5-year strategic plan. I'm pretty
Thank you,
sure
Colleen.
that's what I have. Yeah, you're welcome.
All right. Item 13 is the chair report. I wrote this down, so I know I said some of this already, but the Board of Ed is meeting, the Board of Ed budget process, the Board of Ed is meeting tonight and tomorrow night on their budget. I think the superintendent will deliver the Board of Ed budget to the town manager later this week. I don't know if he walks it over, if it's like a really formal thing. Hopefully he just sends an email, but
He usually walks it over.
that's so sweet of him. Okay. So then Brian and Dr. will have a chance to meet to transfer the budget. We do have a joint meeting with the Board of Ed on the 22nd, THS Library, 7 p.m. Read the Board of Ed budget and Q&A please before then. I already said all that. So I'm not gonna repeat myself. I had chair hour on February 1st, and other chairs joining me included Andy Powell from Planning and Zoning and Linda Byam, who is chair of the Library Foundation. We also had 4 residents join us, and so there were 7 of us in the room, and I don't know if it was crowded. It was
That was
we had-
impressive.
It was. We had multiple conversations going. Like, it was really great to have so many people really engaged during chair hour.
Katie, I usually go down to the chair hour because there's nobody there. Sarah Beth and I go down just to say hi to the chair.
I appreciate that.
That was refreshing to see so many people at the meeting and so many opinions. So good job. Good job beefing that back up again.
Yeah, I hope that that chairs continue to join me on my next chair hour is Thursday, March 7th, and Susie Lusick of the Commission on Persons with Disabilities is scheduled to join me that day. So I think, again, great to see so many residents there. And I know there were some questions that were asked of residents that I was able to pass on to the town manager and then respond back to residents. And Andy Powell is always fun to hang around with. So I had a great time. It did go 90 minutes instead of just an hour because there was so much engagement. So yeah, it was exciting, which is a whole new term of characterization of the chair. And I wanted to especially extend my appreciation to Public Works for clearing up the roads and especially for getting the schools ready for the kids to go back tomorrow with no delay, hopefully. So thank you to all the work that went into getting the kids out the door tomorrow.
Katie, I forgot to thank them for the funeral that they did. this
saw that.
past week as well. Yeah, they've done that several times before, but they're just fantastic. And we could crowdsource a crowd there in 2 seconds if I went on social media. But that there's an employee wellness aspect to it as well, and DPW takes pride in that and not turning it into a circus. So it's a very respectful and kind thing for them to do. A very proud moment for all of us.
Yeah, definitely. It's wonderful to know that that we have such amazing employees who have that much respect for our residents. So thank you very much to them. All right, that's it for me for chair hour. It's now on to communications and petitions from council persons. Does anybody want to talk here? Joe?
Just a question on your chair report. So, and I forgot this process. So has the board passed its own budget yet?
I believe that if I understand correctly, the Board of Ed last week moved a budget forward but didn't pass it. And I think that they're voting tonight on the budget. And then Dr. Willett is gonna have it ready for tomorrow night. I'm not entirely sure if they're voting tonight and tomorrow night, or if they're just voting one of those 2 nights. But it's tonight or tomorrow when the final Board of Ed budget will be passed.
Okay. Do we know what his ask is as far as increase?
Well, on last Wednesday, they moved forward 8.96. I don't know what they're meeting at the same time as us.
Right.
So I don't know what number they're discussing tonight. I haven't gotten any messages about that yet. But they moved forward a budget that 8.96 did not cut any positions. That was the reason for that number.
Wow.
Going any lower cuts positions.
Okay. I mean, that's his typical threat every year, is if you don't hit my number, I'm cutting positions, but that's a long discussion that we're
Yes.
obviously going to have.
Yes,
So
we're going to have, I'm sure, a very robust discussion. And they are having those robust discussions too, which is why
Right.
I encourage you to read the Q&A documents, because there's a lot of information in those documents.
Yeah. Okay. Thank you.
Yep. Jacob.
I was just gonna echo a point you had made, Katie. Just wanted to thank all the public works folks that were out today and last night, keeping the roads safe and keeping the town safe.
Thank you. Anyone else? Colleen, go ahead.
Hold on 1 second, Katie. 6:45. Sorry, my husband was asking what time to set the alarm for tomorrow, so sorry. I was just echoing what everybody else has already said. Thank you, town staff and DPW and the public safety for everything they do, obviously, every day. And I agree with Joe, it's all that Board of Ed stuff's gonna be for a bigger discussion, and but look, I want to just add, it looks pretty good. We have council, I think, outnumbered a little bit. We have 4 of us that have at least served on the Board of Education. So I think between Joe, Jen, myself, and Jacob, we have a lot of history, and Jen offers some different views on how Vernon handled their budget process. So, and this should be a great group to be having those tough discussions with.
Yeah, I really appreciate that, because this process is complicated and very nuanced. And so having people who have experience and familiarity with it, I think is going to be invaluable this year. So thank you all, and I look forward to future discussions. Any other comments? Okay. We shall move forward on to public participation. Let's see, it says any subject within the jurisdiction of the town council with a 3-minute limit. So if you would like to speak, you can raise your Zoom hand or press *9. We do ask for you to tell us your name and your address. And this is the time. So if you want to raise your hand, anybody want to talk? Nope. Anybody? Okay. Well, since we don't have anyone who wants to speak, we go on to the last item on our agenda, number 16, which is adjournment. Is
So
there Thanks, Jen. Is there a second by Jacob? Is there any objection to adjournment? Any objection? Any objection? So without objection, we are adjourned. Thank you everyone so much. Thank you for the flexibility of doing this over Zoom tonight, and have a great night.